Hello everyone, welcome. Great to see you all. Today we are going to talk about very interesting topic, what is biological model of health means from homeopathic treatment. This presentation was made by Dr. Samreen and guided by Dr. Channabasava Reddy. Let's learn together. First, let's look at our goal. By the end of this talk, you should be able to briefly explain the different models or thinking the way about health psychology. Explain the biological method of health. Explain how we use these. Now, what is the model? A model is a simple picture of something complicated. It makes the complicated thing easier to understand. It is like a map for a big city. So, what are the main models in health psychology? The biomedical model. This is a simple way. It looks only at the physical body and disease. The psychosocial model of health. This is the bigger, holistic, whole person way. It looks at the body bio and the mind psycho, and social life is called the social altogether. Now, David On's model. These are the special for homeopathy. They help us understand health and sickness in different ways. The health belief model. This is about what people believe about health and how they behave. Now, this slide shown the difference between the simple biomedical model and the bigger biopsychosocial model. It reminds us that to understand a patient we must look at their whole life, not just their body. Oh, on the page 7 there is a little mistake. With math problem we can just ignore that. Now let's talk about the David On's model. He gives 5 different lessons. Exactly. So 5 different lenses like glasses to look at a patient. Pathogenic model. This model is all about the cause of sickness. Biological model. This is our main today's topic. It is about how body react to a cause. Holistic model. This look at whole person, their mind, body and all their symptoms together. This is called totality. Now holographic model. This looks for the main theme of or essence, the core feeling behind the all symptoms. Now relational model. This is about the relationship between a doctor and a patient. The doctor feels what patient feels. The best part, we do not use the just one model. A good homeopath uses all models together like different tools to find best medicine. Let's see these models work together. This table is very helpful. It shows that biological and pathogenic models are more objective based on the fact, but you can see the focus on the external cause or local symptoms. They often use lower potencies like 30C or 6C for simple cases. The relation and holographic model are more subjective, based on feelings and ideas. They deal with deeper hidden problems. They use often very high potencies, 1M or 10M, for confused or complex cases. The holistic model is in the middle. We can also how each model connects to our Materia Medica, the big book of medicines. For the biological model, we use main symptoms and keynotes. For example, using the upper meticulum, cuprum metallicum for night cramps. Finally, we see the prescribing method. For the biological method, it is mean local and or clinic prescribing single notes, strange, rare and PQRS symptoms, the complete symptoms. So let's finish today. Each model of health is like a different pair of glasses. Each one lets us see our patients and their medicine in the different ways. As homeopaths, we need to be flexible. We need to use all these glasses. Remember, these 5 models are the tools in your toolbox. We do not use just one tool for every job. You use them all together based on what the patient needs. This is how we truly understand a patient and find the best way to help them heal. Thank you so much for your attention. It was a pleasure to talk with you today. Subscribe my channel. Hit the bell icon so you can never miss any update. Okay, let's focus on our star, the biological model of health. Biological model of health. Okay. This model comes from the pathogenic model, the cause model. It sees health as body's ability to fix itself after a problem. This is called homeostasis or autoregulation, self-regulation. It seems cause and effect in a straight line. A cause happen, then an effect, a symptom happen. In this model, symptoms are not bad, but they are important information. They are the body's smart way of trying to heal itself. For example, overcoming a cause, diarrhea. Overcoming a cause, diarrhea from food help push the poison out. Repairing the damage. A scar forms after the cut to heal the skin, adjusting the damage. Arthritic pain makes you move less to protect the joint. So in the model, no symptoms means the person is healthy. So how do we use this in clinic? When we use biological model, we try to understand the cause behind the cause. We ask questions like, why did this happen now? Why has it caused these particular symptoms? Means specific symptoms. How did your body respond? What is the disease process? In long term, why not better even after the cause is gone. We know the sickness can be simple, one cause, one effect, or complex. There we are. And complex, many cause leading to the many effects, like poverty. Being poor can lead to bad food, which can lead to the sickness. So treatment in the biological model is often based on the main symptoms you see. A medicine is chosen based on the keynotes. Keynotes are strong, important, and strange symptoms. What helps us choose a medicine in this model? One single main symptoms, one single PQRS. PQRS means peculiar, queen, rare symptoms, or strange. It is a weird and unique symptom. The complete symptom, a symptom with all in detail, where, when, how it feels, what make it better, worse, local or clinic. The symptoms you can see or measure. Here is a great example from this slide. A 27 years old woman, 24 weeks pregnant, had too much vomiting. Only strange PQRS symptoms was she now had an aversion to water. She did not want water even though she was usually a thirsty person. This one is a strong symptom. Lead to the medicine phosphorus. Phosphorus 200 helped in just 2 days. This shows the power of finding the key biological symptoms. This model is best for simple cases. They often short-term acute illness with clear, easy to see symptoms. They get better quickly if they are not deeper